Hello, welcome to our continuation of knuckle cord. And in this class, we are going to focus more on management and their complications. So, if you're new here, my name is Winnie Barawa, and this is a channel where we focus on learning and knowledge in terms of health and any other specialization that pertains to it. And if you're new, remember to subscribe, share, and comment concerning what we teach. So in today's class, we are going to finish on what we started, and in the previous class, we did knuckle cord looking at the types and their causes. So please keep with me and let's move to our next questions. We are talking about the management of knuckle cord, and in the previous lessons, we have discussed on the different types, the risk and signs and symptoms to look for. But what do you do if you've realized a child has a knuckle cord? Maybe you have discovered it in the ultrasound, or you have seen it while the child is being delivered. So there are different maneuvers that you can use to deliver a knuckle cord or a cord around the neck, and this will also depend on the type that you have detected. So let's start with the easiest intervention that you can give when you're worried about a knuckle cord. And the one of it is if you discover the cord when the child is just coming out, or they have crowned and the head has already been delivered and you have felt it around the neck, the safest way to do for you is to slip the cord over the baby's head to decrease any nature of compression while you are attempting to deliver the child's shoulders or body. So by illustration is where we are here. So this is our child who is at the verge of being delivered, and the head is already delivered, and you've detected the cord around the neck. So the best thing here is to feel if the cord is tight. Don't pull the cord immediately. Feel first if the cord is tight or if it's loose. If you have detected a loose cord, you can then unwrap it or slip it over the head of that child to keep the child free from the cord and to prevent any compression around it or to prevent any tightening around it, and deliver the baby now, be free to come out. But what else can you do and you're having a knuckle cord with the baby? So in other maneuvers where you're managing a knuckle cord, if you discover the knuckle cord during the pregnancy period and you have detected non-reassuring fetal heart rate, it's always advised that you plan for an emergency cesarean section. Let the mother be taken for an emergency CS. Let the child be delivered with the fastest management possible, because a non-reassuring fetal heart is a risk that a child can easily go into stillbirth, or the child might die before they have been successfully delivered. So a cesarean section is an intervention when you have monitored the fetal heart rates, you have monitored the movements, you've monitored the labor, and you feel like the fetal heart is not reassuring enough, and you could be risking losing the child, or you'll be risking complications to the child if you don't intervene immediately. The other aspect that you can do is an intervention where you talk about double clamping and transecting the cord. In states whereby the cord is very tight around the neck, you are actually advised, if you can quickly clamp the cord, double, and cut it, and then make sure that you deliver that child immediately so that you do not delay the supply of oxygen and nutrient to the child at the point where they are yet to be delivered. So you are allowed to intervene with double clamping only when you are sure that you can quickly deliver that baby and initiate breathing on their own. Unfortunately, do not double clamp when the child is yet to come out. So if the child has been delivered, let's say they're at the level of shoulder point, or the head is already out, then you can double clamp and transect the cord and quickly intervene to have the child delivered immediately. However, if you're worried that the delivery is not yet, the head is not yet out and the rotations are not active, then do not quickly clamp the cord, because it will mean there'll still be low supply of oxygen to this child and it may risk complications. The last management that you can also give is what we call the somersault maneuvers. So with the somersault maneuver is a technique where you are allowed to rotate the child heads towards the thighs of the mother or towards the pelvis area of the mother, and then you slip off the cord, just as we are illustrating on our child here. So you can rotate the child towards the thigh areas of the mother, and then doing this means you are loosening the cord, and then you can slip it over and bring the child out. So those are the maneuvers you can do. So you can slip the cord over the head of the child. You can prepare for emergency CS if you're worried about the fetal heart. You can double clamp and cut the cord to free the child from the connection and deliver the child freely out of risk. Or you can do the somersault maneuvers, rotating the child to the side of the thighs of the mother. Any of it, you can choose any that you wish to use, and then you freely free the cord from the mother over their heads and deliver it. So what complications can come out when you're dealing with an Nuchal cord? There are many, but first of all, be keen on how to handle it, because with the complications, there can be even a formation of knots or cord knots. And cord knot is a state whereby the cord ties itself to form like a cord, how a rope can form a knot. Another moment, you can have tight cords, and when the tight cord gets to form around the neck, it can lead to a neck syndrome, a concentration of symptoms that show you that the cord was tight and it came with complications. So a cord, the tight cord around the neck syndrome is known as the Tecan syndrome, and this comes with symptoms such as reduced fetal heart, or the child comes with, we will see later on all those symptoms where there's this dull face on bluishness and difficulty in breathing and such. Then it can also lead to intrauterine growth restrictions because of the cord around the neck. The child can have fetal developmental delays. The child can bring symptoms of decreased amniotic fluid volumes and so on. Other complications can include neonatal anemia because of the low supply of oxygen and blood to the child. Can also have decreased fetal movements. The child can also develop hypovolemia and metabolic acidosis. Hypovolemia is generally because of the cut of supply of blood to the child from the mother, and metabolic acidosis is due to the cut of oxygen supply from the mother to the child. You can have postdatism, of course, because of the delay in development, delay in the fetal growth. All this can complicate with cases of postdatism. In rare situation, you can have intrauterine fetal death, but most Nuchal cords are not that risky as per se, and so the child can be born with slight complication, but there shouldn't be major complication if the pregnancy is well managed and intervened correctly at the right time without any delays. So as much as there are all these complications, they majorly come in if there is delay in interventions, or there were no interventions at all, and so the cord was left to become tight and led to all this aura of complications that led to all these complications. So what are the symptoms that can show on a baby if the cord has tightened and the cut of oxygen and blood has happened to the child? So there'll be the darkness of the face, and there's the facial petechiae, and in some cases there'll be bleeding in the whiteness of the eye or the sclera. Reason being, if the cord has tightened so much on the neck, and now the child is having cut off supply of oxygen and blood to the baby, but also remember we are tightening the neck, and this is like a strangling state. So the child will start presenting with the darkness of the face. Like I see, the face looks dark or bluish because of the loss of oxygen supply or the loss of blood supply to the child in general. But also there'll be an appearance of like facial petechiae. Facial petechiae are those dark spots that appear on the skin due to some status which shows there's cut off of oxygen, or minor bleeders on the face, and then the bleeding on the sclera and so on. So all these are symptoms that will tell you this child was at risk of complications from the Nuchal cords. Thank you so much for staying with us to the end. And like I said before, don't forget to subscribe. Click on the notification button so that you can be informed when we do the next class. Share these lessons with your friends. Comment on which also you prefer us to teach on, and like our video. Thank you so much for staying to the end, and let's meet in our next lessons. Bye bye.